Welcome back to Gastro-oesophageal reflux disease. Today, we'll talk a little bit about what is involved in the surgery. Generally speaking, surgery is recommended to those who have not responded to medical treatment or proton pump inhibitors, those who have hiatus hernia which cannot be treated with medications, and those who have developed complications as a result of reflux going on for a prolonged period of time. Now, surgery is a keyhole surgery. It usually involves two major steps. One, tightening the junction between the esophagus and the stomach, and wrapping of the top part of the stomach around the lower part of the esophagus, essentially recreating the valve to minimize the reflux of stomach contents into the esophagus. The hospital stay is usually 1 to 2 days, and the patients tend to go home on either a sloppy or soft diet. As with any surgery, this has potential complications. Some are general and some are specific. One should discuss these further with the surgeon involved. Next time, we'll talk about what to expect after the surgery in the short term as well as in the long term.